The world's most beautiful beaches line the southern edge of the Florida Panhandle. The waves and white sand attract millions to our coastlines and countless dollars to resorts and business owners. But many who rely on work in this tourist industry have little to live on, sometimes even less when it comes to their health care. The lack of affordable health care on the Panhandle in 2001 was a major concern for health leaders with a heart. After 9/11, local leaders came together under the direction of Mike Hill and applied for a federal grant. The grant was designed to hire doctors and open clinics in rural areas to prepare for future disasters. This led to the opening of the first free 1,500 square foot medical clinic in Panama City, Florida. The following year, these leaders founded a 501c3 nonprofit called PanCare of Florida, short for Panhandle Care. In 2005, PanCare was designated a federally qualified health center, and that first medical clinic moved to a larger location in Panama City, which nearly doubled its size and services. The original location became PanCare's new dental clinic. It too has expanded and exists at the same location. PanCare opened the few medical and dental facilities which accepted Medicaid,
Take a deep breath.
and the only ones where services were rendered on a sliding scale to those without any insurance. The demand for more clinics grew rapidly to other areas of the Panhandle. In 2009, PanCare opened its first Walton County clinic in Santa Rosa Beach with more federal grants, and later moved that facility in 2011 10 miles north to Freeport. This is where PanCare combined health and dental services under one roof. Former governor and presidential candidate Bob Graham joined PanCare's leaders in dedicating the new community health center.
The citizens of this wonderful community.
It was named for his grandfather, who once practiced in this rural community. That same year, members of the Muskogee Nation of Florida offered PanCare a piece of their land in nearby Bruce for a clinic to serve all people of that community. The Florida Blue Foundation gave $100,000 to PanCare to help make that medical clinic a reality. U.S. Congressman Jeff Miller was part of the dedication.
I love to come home from Washington for reasons that I look out and I see today. Real faces of real people.
Hundreds of tribe members celebrated that day with dancing alongside a community that came together for a day of family fun. PanCare of Florida's unique low-cost services made PanCare popular in rural areas. Demand for its services pressured leaders to acquire a 40-foot medical and dental bus. The new Clinic on Wheels makes it possible for PanCare to reach into rural regions where dental and medical services are non-existent. This mobile service will continue now that PanCare has recently acquired 2 additional mobile medical units which will soon be on our rural roads. In 2013 and 14, PanCare opened 4 more clinics in 4 additional counties. These federally qualified community health centers are located in Calhoun County, Holmes County, Liberty County, and Washington County. PanCare services now go beyond opening medical and dental clinics. It actually empowers people with information they seek to improve the quality of their lives. For instance, PanCare teamed up with child star Jerry Mathers of Leave It to Beaver in early 2014 and orchestrated a free conference for the general public about diabetes.
And it does take a lot of work. I have to figure out when I can eat, how much I can eat. I don't snack. I don't eat a lot of candies and sugars and treats.
The event not only received broad media coverage,
Channel 7's Amila West tells us Mathers says it's about a healthy lifestyle habit.
but it provided much-needed information to diabetics and their caregivers. It also bonded PanCare's medical teams with endocrinologists and community specialists to further enhance PanCare's patient care.
Most of my type 2 diabetics, the classic person that I see is I took metformin, then I had to take glyburide.
Another way PanCare empowers the public is through the availability of free health and social service resource directories. These directories are currently available in Walton County and are being revised for residents in all counties where PanCare facilities are located. PanCare provides free mental health counseling to patients at its Panama City Medical Clinic and is expanding their behavioral health services through a federal grant.
Have you heard about the new healthcare.gov?
PanCare also hires community health workers and certified application counselors to assist Panhandle consumers with enrollment into affordable health insurance plans. PanCare also offers free blood sugar screenings and blood pressure checks at every possible festival and fair staff can attend, along with entertaining ways to present health and dental messages at events like the Florida Chautauqua Assembly.
the PanCare bus. Are you familiar with those guys? When you need a little extra assistance in medical or dental, if you don't have quite enough insurance, visit our friends over at PanCare.
At this 2013 event, PanCare staff was honored to welcome a visit by former First Lady Rosalynn Carter. One of PanCare's most coveted and celebrated community programs is Stand Up for Veterans Day. This is where PanCare's medical and dental clinics in Bay and Walton counties are opened free of charge for a day to any veteran who honorably served in the United States military, whether they're a patient of ours or not. PanCare strives to make resources available to the general public, whether at its clinics, festivals with information booths, fairs, bluegrass gatherings, or events for kids. The leaders and staff of PanCare feel they have a responsibility to the community. That is, to provide affordable health and dental care and to empower patients with critical information they need to improve the quality of their lives.
Okay, everyone's health needs are different, but whether you see your doctor once a year or a lot more often, it can be a hassle. First, it's often hard to get an appointment. You rush to get there, but you may end up waiting if they're running late. And your doctor's rushed too, so even though she'd like to spend more time with you, she only has a few minutes to find out what's wrong. The fact is, you may end up feeling like just a number or just the next person in a long line. So your doctor only hears about your sore throat or swollen knee, that pain in your back, or your daughter's cough, and there's no time for you and your doctor to really talk. It's even worse if you have a problem in the middle of the night and you're not sure if it's serious. Do you wait and try to get an appointment? Or do you go to the ER where the doctor doesn't know you and wants to run all kinds of tests? Will your insurance cover all those? It's a lot to deal with. And it's even more complicated if you need to see specialists like a cardiologist, an allergist, or a dietitian. That's a lot of different healthcare providers giving you tests, prescriptions, and treatments. And no one provider knows what the others are doing. When you think about it, they're each just looking at a piece of you, so no one sees the whole picture. Shouldn't this be a lot easier and less confusing? Well, yeah, that's why there's a new approach to healthcare that puts all the pieces together. It's called the patient-centered medical home, and it's a way to give you better, more personal care. Now, even though it's called medical home, it's not a place. It's actually much bigger than that. It's a whole team of people who know you and work together to give you the best care. It's led by your personal healthcare provider who gets to know you well and works with people like nurses and pharmacists to make sure everyone's on the same page when it comes to your care. There are also people on the team to help you with things like medication costs or insurance questions. Basically, your team is made up of whoever you need, so it changes as your health needs change. For example, if you need a specialist, your team can help you find someone who's right for you, and your personal provider will keep up on everything and help make sure the whole team is in the loop about your treatment. In fact, many medical homes also use things like electronic health records to help coordinate your care. That way, you don't have to keep going over the same information with each healthcare provider. Look, your time is valuable, and your team knows you've got a lot going on. So with Medical Home, it's easier to get care when you need it. If you've got a problem at night or on the weekend, they want you to call. And you may be able to get the help or information you need without even going into the office. Or if you need to come in, the schedule during the week is actually a lot more flexible. So you can often get a same-day appointment, or even a longer appointment if you need it. But patient-centered care isn't just about getting help when you or someone in your family gets sick. It's about preventing problems so you stay healthy. They'll make sure you get things like a yearly checkup or any shots, and your care is tailored or custom-made based on your health and family history. So if you need any kind of test, they'll contact you to explain the results and schedule any follow-up care. Because once you have the whole picture, you and your provider can work together to make decisions about your health. It's a partnership, so speak up. After all, they want you to ask questions, and they want to hear about anything you'd like to change or improve. Do you need to get more sleep, lower your cholesterol, or lower your stress level? They'll help you set goals that make sense for you. Then it's up to you to make those changes and to let them know how it's going. And when it comes to things like asthma, diabetes, or high blood pressure, they know this can be overwhelming. So your team will make sure you get the tools you need. They'll also take time to explain everything, make sure you have the support and resources you need, and listen to your concerns. Because caring for the emotional side is just as important as the physical side. After all, you're not just a name on a chart, you're a whole person. And with the patient-centered medical home, your team provides healthcare that fits your life. So you feel taken care of and, well, at home.
Brush, brushy, brush, brushy, brush, brush your teeth. Every day and every night. Now it's your parents' turn. Here's what you gotta do. Let them have your toothbrush so that they can brushy brush your teeth. Good job, you're almost done. 5, 4, 3, 2, 1. That's it! Help your teeth stay healthy. Brushy brush with a grown-up every day. Kids will spend 8 minutes decorating their little brother.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
Jimmy can't sing, and Tommy can't dance, so we're gonna put some ants in their pants. Aww, and walk like a monkey, hop like a bunny. Isn't that funny? Ants in their pants, they've got ants in their pants. They've got ants in their pants, they've got ants in their pants. Ants in their pants, they've got ants in their pants. They've got ants in their pants. They've got ants in their pants.
One more time.
Jimmy can't sing, and Tommy can't dance, so we're gonna put some ants in their pants. Aww.
Kids will spend 22 minutes watching us, the super duper party troopers, singing about ants in their pants.
Isn't that funny? Ants in their pants, they've got ants in their pants. They've got ants in their pants, they've got...
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
Diabetes is a common condition that affects all kinds of people all over the world. It prevents your body from making enough insulin and using it properly. What's insulin? Well, insulin is a hormone your body needs to change food into energy. This is very important because your body needs energy to work well. Your body is made up of many different organs, and they do many different things. One of these organs is called the pancreas, which is where your body makes insulin. When you eat something, your digestive system breaks the food down so it can move through your blood and into your cells. Carbohydrates, or starches, are broken down into glucose, a type of sugar. Your cells use glucose as fuel. Insulin moves glucose out of your blood and into your cells. That's so your body can create enough energy to get you through the day. It's easy. You just have to create your plate. Let me explain. First, take a look at your plate, which should be about 9 inches across. Then, imagine a line running down the middle of the plate. On one side, divide it into 2 more sections. Fill the largest portion of your plate with non-starchy vegetables, things like salad, green beans, broccoli, cauliflower, cabbage, carrots, and tomatoes. In one of the smaller sections, put starchy foods like noodles, rice, corn, or potatoes. In the other smaller section, place your protein foods. This includes foods such as beef, fish, chicken, turkey, or meat substitutes like tofu. Finally, add an 8-ounce glass of lower-fat milk, along with a piece of fruit or a half a cup of fruit salad, and you have your meal planned.
You do, me, Jerry Mathers, from the television show Leave It to Beaver. I've been diagnosed with the disease, diabetic peripheral neuropathy, or DPN. DPN is damage to the nerve tissue of the peripheral nervous system. 60 to 70% of people with diabetes have some form of neuropathy. The most common form affects the hands and feet and can cause pain, burning sensation, and in severe cases, total loss of feeling. People with DPN need to take special care of their feet. More than half of the lower limb amputations occur in people with diabetes. Be proactive, monitor your blood glucose levels, follow medication therapies, and maintain proper foot health with your podiatrist. It worked for me. To learn more about DPN, go to www.neuropathyaction.org.
I remember being out, actually playing basketball in the front of our house. There was a lot going on.
I had no control over it. The first thing in my mind was, I hope I'm not dying.
They took off. We didn't know what was going on.
I started to lose control from my feet, and it started working its way all the way up to the top. And that's when they started saying, you need to get the family now. Paulette's not gonna make it.
Later that night, we met up with everyone at the hospital, and that's when we got the news that
it was a stroke. I didn't get any type of movement. For at least the first 3 months, my right side started coming back. The left side was still totally paralyzed.
You know, it was tough. I didn't know if my mom was gonna stay like that, how better was her condition gonna get.
They didn't really understand.
The only thing I knew of is what I saw. That was her, you know, struggling with her day-to-day stuff.
I went from wheelchair to a sliding board, to the car, back home, in the bed, and that was kind of my life the first 2 years.
You know, seeing her go through her therapy, you know, taking every day to get better.
I had to learn to eat all over again. I couldn't comb my hair.
You know, you gradually saw her improvements, you know, where now she's, you know, a lot better off than where she started.
So I had to overcome it, and I'm a believer and I have faith that if I didn't die then, I'm not dying now.
You know, it gave us all hope, especially me.
And I tell every one of them, you know, I want to work hard and try and fight and come back and show you guys you can fight back.
So she's the reason why I work hard and the reason why, you know, I'm in the position I'm in now.
Long as you keep the positive things going in mind and you have things to live for and look for, it makes you want to fight more.
I guess sometimes things just happen. Devastating things. It's got nothing to do with fairness. Bam. Your whole world changes in an instant. And you never see it coming. That's what happened to me the day my mother had a stroke. I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Protect the ones you love. Spot a stroke. F-A-S-T. Fast.
Quiet, please. Wait a sec. I'll take one. Oh, yeah. All right. All good. Take care. Way to go. Nice. Bring it on. Gotcha. I'm here for you. Oh no. Please, please, please. I'm waiting. Interesting. Not buying it. Not fair. That's it. This conversation is over. Oh, brother.
Body language can tell you all sorts of things.
I'm having a stroke. I'm having a stroke.
Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
I had pains in my chest and I couldn't breathe.
It was just like someone had set me on fire.
Started with the pains in my shoulders.
I was feeling this pain in the center of my chest that wasn't normal.
And Richard said, "Are you okay?" And I half answered with, "I don't think so."
But the worst was when it went into my arms and down to my wrist.
I woke up in the ER that evening.
Warning signs can be different for everyone, but there are several distinct warning signs or symptoms of a heart attack. Uncomfortable pressure, squeezing, fullness or pain in the center of the chest that lasts more than a few minutes or goes away and comes back. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Some victims complain about leg cramps and pains. Shortness of breath, which may occur with or without chest discomfort. Other signs may include cold sweats, nausea, or lightheadedness. If you experience any of these signs, chest discomfort, pain in your upper body, arms and legs, shortness of breath, nausea, or dizziness, take immediate action. Don't wait. Call 911 and get to a hospital right away. By acting quickly, you can benefit from new drugs and treatments that can minimize your heart damage, increase your odds of a speedy recovery, and even save your life. But time is critical.
So they say it's a man's world? Well, I don't see anybody's name on it. While they were out doing their thing, we slowly changed all that. We changed all that. Today, women can do anything men can do. And there's one thing we're even better at.
Yeah, I think it's always a thought that's in the back of everybody's mind about getting breast cancer.
My grandmother passed of breast cancer. My aunt has been diagnosed with breast cancer.
I do know people who have had breast cancer and who have passed away from breast cancer and who have survived breast cancer. And it is a huge concern as a woman.
Breast cancer is very common. It is, during the course of a woman's lifetime, she has about a 1 in 8 chance of developing breast cancer. So it is a very common disease for women.
I get my mammograms every year. I do self-checks. Very concerned. Too many women have it.
I would say probably within my smaller group of friends, we're pretty much educated about the disease and do get yearly mammograms.
When I had my first mammogram was because the doctor mentioned to me that a woman age 40 should get a mammogram to be screened for breast cancer, because a mammogram it can show a tumor that can be cancerous, and you might have cancer and you don't know, and it cannot be felt. I didn't feel that I had a tumor on my right breast. It was a surprise because there was no cancer in my family. It was a big surprise.
The majority of women who develop breast cancer do not have a family history of breast cancer. Between 70 and 80% of women who develop breast cancer, in fact, do not have a family history. So it's very important that women understand that the absence of a family history does not protect them from breast cancer.
I don't understand why they're not getting the mammograms. Do they hurt? Maybe just a little bit.
It's a little pain, but not something you can accept it. So it's good.
The experience is okay. Of course, the first experience was a little stressful, but besides that, it's definitely needed and a concern for me.
It was uncomfortable. I mean, come on. It was uncomfortable, but it's not. Women have babies, for crying out loud.
Mammograms are uncomfortable, but you know, it's pretty quick, and the technicians are usually very nice and understanding, and it's not embarrassing. They're they're as gentle as they can be and patient, and I've never had a bad experience.
There are some things that women can do to minimize the discomfort of the compression that's associated with a mammogram. For example, avoiding scheduling a mammogram during your period or the week before your menstrual period is helpful. Scheduling it after your menstrual period will minimize the amount of discomfort that you experience during a mammogram.
I think one of the reasons women do not get mammograms is if they are not covered by their insurance.
Financial resources and health insurance is the key to early detection and knowledge about the disease and follow-up.
You know, you could check in your community because some places they have free tests. So it's something free, you don't need to pay nothing, you prevent something. So it's good.
There are mammograms, free mammograms for the uninsured and the underinsured. You have to do some research, but if you call American Cancer Society or go to their website, you can contact and they will do the research for you to see where there is free mammograms in your area.
You know what? Don't be afraid to find out, because the sooner you find out, the more chances you have that it can be taken care of.
I've had 3 biopsies because of my past history, and I'm really glad that I was having my mammograms. There wasn't anything, it was calcifications and thankfully, but because of the mammograms, I was able to check that out.
It has to be yearly because, I mean, it can change from one year to another year. That's what happened to me. I mean, my first year when I went to take the mammogram, if the results were negative, and then the next year they were positive. So it can be the next time or it cannot be the next time. I mean, you never know.
Most women do partake in mammography screening, and that's a huge public health success story. There's still a significant number of women who don't get mammography, and those are the women we have to reach out to.
The earlier they catch it, the best they can get rid of it. If they catch it late, the ramifications of a late check are deadly.
You love yourself, you know. You love your family. It's something you need to do for you and your family.
Give yourself a chance to live, you know? I mean, just go get the mammogram.
Alzheimer's, an urgent epidemic. Alzheimer's disease has been around for thousands of years, and it's always been a personal and family tragedy. But now, it's becoming a social catastrophe. That's because people are living longer than ever before, thanks to modern medicine. Hundreds of millions of people reaching their 70s, 80s, and 90s. Sadly, the risk of getting Alzheimer's increases with every year of age. Worldwide, roughly 1% of 65-year-olds have the disease. That shoots up to nearly 10% of 75-year-olds and about 20% of 85-year-olds. Already, 24 million people across the world have this fatal disease, and that's expected to double over the next 20 years and then double again, if we don't do something to slow it down or stop it. Costs will skyrocket and threaten to bankrupt national healthcare systems. This is a disease that will cripple economies and communities everywhere. The good news is that scientists now understand much about how Alzheimer's ravages the brain, and they have many good ideas about how to stop it. The bad news is that Alzheimer's research is expensive and slow and doesn't get nearly the government support that it urgently requires. In short, we are facing an excruciating and ruthlessly expensive epidemic. As a society, we cannot afford to let this disease continue on its present course. We must fight Alzheimer's with every ounce of effort. Please do your part by helping your friends, neighbors, and elected representatives understand the urgency of the Alzheimer's epidemic. Thank you. Learn more at www.aboutalz.org.
One disease, millions of lives permanently disrupted. Today, there are over 5 million Americans living with Alzheimer's disease. But Alzheimer's is taking more than memories. It's taking lives. What few realize is that Alzheimer's kills more people than breast cancer and prostate cancer combined. And Alzheimer's is the only disease in the top 10 causes of death that can't be slowed, stopped, or prevented. From 2000 to 2013, while deaths from other diseases decreased significantly, Alzheimer's deaths increased 71%. But equally disturbing, many living with Alzheimer's say they are not being told their diagnosis. While more than 90% of people with the most common types of cancer say they are told their diagnosis, only 45% of people with Alzheimer's or their caregivers say they are told. The economic toll is staggering too. In 2015, it will cost the nation $226 billion to care for people with Alzheimer's. By 2030, 72 million baby boomers will reach an age of greater risk. The fact is, everyone's at risk for Alzheimer's, even you. But everyone can help, especially you. We're the Alzheimer's Association, the brains behind saving yours. Join us.
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him opening his own clothing store at the age of 18? 1 in 138,000. Excited to be a part of pop culture, he packed for the big city. The odds of finding someone to invest in his vision? 1 in 4.5 million. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs. Early diagnosis can make a lifetime of difference.
Maybe he's really focused.
Hey, Michael. Michael. Maybe he likes spinning the wheels.
Maybe he just loves trucks.
Maybe he's just being a boy.
Preoccupation with objects is one early sign of autism. Learn the others today. The sooner it's diagnosed, the better.
You can be a hero by being prepared for an emergency. First, make a plan. Call a family meeting to plan for things like how to connect with loved ones after an emergency.
There.
Or your escape route.
I am not fast.
Build a kit. When disaster strikes, it's important to have enough supplies to last 3 days. And don't forget the batteries.
Low battery.
Number 3, know the facts. From blackouts to floods, no matter the emergency, the more you know about it, the better you can deal with it.
You're gonna need some upgrades.
Number 4, get involved. Lend a hand in your community to help others know their role in an emergency.
You guys, do you feel this? We're gonna be heroes!
You can be a hero by being prepared.
Yes!
Visit ready.gov/kids for more preparedness tips.